Now with us here, Dr. Rui Santos, President of INFARMED, national authorities for the medicines and health technologies, here with us. And it's really a pleasure that we are able to send this broadcast from live from INFARMED.
Thank you again, and all welcome. Allow me just to say a few words on the broad topic of this meeting that is occurring during this weekend, that has this session special with session today. So one is just three notes. One is on the importance of health data. I think we know how important is the use of health data in evaluation processes, facilitating decision making, providing supports on many issues that go from controlling expenses, detection of fraud, supporting the best use of technologies in patients. So there's a number of areas where we see the importance of developing the best use of health data. There are particular areas where this is most relevant. We have some experience here that I will mention afterwards at INFARMED. I think also that the current pandemic situation is also showing the importance of having access to the data, but particularly to create conditions to share and improve collaboration and cooperation in this field. The second note is on the use that we are having. I mean, of course, I'm speaking from the perspective of INFARMED, as we are as Paulo Abreu has mentioned, the Medicines and Health Products Regulatory Authority. Our experience is like in many other contexts, is developing, but I think we have quite a good basis to improve this utilization. We have the possibility of having a national health system, which is a public-based health system, which is an integrated system. So we have data that derive from many sources, from hospitals, from pharmacies, from the pharmaceutical industry, from other healthcare settings. So already today we are using this information in monitoring the use of medicines, monitoring the use of medical devices, looking at the expenditure, at the costs of medicines. We have more recently improved the utilization of the data on medical devices, because we are one of the few countries which have a registry of the medical device, so which allow us to connect the different devices with the utilization in our NHS. This is something we are paying a lot of attention right now. And also I wanted to mention two other aspects. One is the collaboration at EU level. We have a number of experience that already exist. For example, in the network, the so-called UNETA, the network of organization responsible for HTA assessment, where INFARMED takes an active role. We have developed many methodologies and actions in relation to better use of data. And as I said, also the COVID has shown more needs and also the opportunities to collaborate together. In concrete terms, in Europe, we are seeing in my field two very important developments that I would like to mention. One is on the monitoring of the availability of medicines, a growing problem over the world. I mean, and we are now here with India on the other side, which is a very important producer of some APIs. So this is a very important issue for health systems to have access to the products. I'm not talking about the new ones. I'm talking about many times the basic ones. So the monitoring of this is very important, and this is something you will see initiatives being launched in Europe in the coming weeks related to that. And the other is the monitoring of the new products, the innovative products, the more complex products, the more bringing together devices and drugs. This will be more and more relevant. We will have the case of the vaccines, which will show how important will be the creation of platforms that will monitor the safety, particularly of the use of this vaccine. So these are just examples. Here at INFARMED, we are also reorganizing a little bit our structure to have dedicated teams to this. So I think we see very important developments for the future. So there will be a lot of opportunities and a lot of possibilities of the developing, as I said, not only addressing the basic needs, because it's also important that we not forget the basic needs of our health systems and the needs of our citizens and patients, but also to look into, of course, the new developments, the more complex developments that are, and then certainly Professor Lars Montelius knows more about this even than me, because in the area where he works. But also just a final word to mention that there are initiatives that are being launched at EU level, the health data space, for example, and also the pharmaceutical strategy. This will be two key initiatives that will also be very high on the priorities for our next semester, because Portugal will hold the presidency of the Council of the European Union. And if you see the program for our presidency, of course, this is linked to the program of the trio of presidencies. So Germany, which is currently the presidency, now then Portugal, and afterwards Slovenia. And in this context, these two issues, one, the digital area, and the other one, the access, the availability, access, and affordability of medicines. These will be two key priorities for our presidency, where I see that there will be very important opportunities for these aspects that we'll be discussing in this conference. And of course, I also wish that there will be opportunities for cooperation in between the different regions, which I think will be the discussion later on. So again, thank you very much for allowing me to address you, and I wish you a very fruitful meeting today. Thank you.
Thank you. Thank you so much. I would ask kindly all the participants to turn their video on, and a round of applause to Dr. Ruivo for the many hours and in INFARMED all this team is doing in the fight against COVID, and they will be our hope when the vaccine comes, with the nightmare of the logistic problems, that INFARMED is going to make sure the vaccine reaches all in each country, just not the INFARMED in Portugal, but other authorities in other countries. So please turn up your videos, and a round of applause to Dr. Ruivo, and thankful for the great work that health professionals are doing in fighting this pandemic. Thank you. Thank you so much. So, and now with the second speaker for the opening is Professor Lars Montelius. I'm very, very pleased to have with the INL, our global research and development partner. So a strong partnership is developed now with the Health Data Forum and the INL with a look of 2021. And it's really, really a pleasure, Professor Lars Montelius, to have you here with us. And the floor is now yours for the opening comments for this EU-India Mashup Day.
Thank you very much, Paulo. And all of you, would like to wish you very much welcome to this day of interventions that we are looking very much forward to. And as Paulo said, we are now a global R&D partner to the health data. And we are particularly interested in activities that kind of be more pronounced together with India. So it's of special interest for us to have participation in this event today. So just a few words. INL is an intergovernmental research laboratory. We are situated, we're headquartered here in Portugal, but we have activities worldwide. So we are an orchestrator for science and technology in order to deploy it to the better need for society. So at INL today, it's about 420 people working from 40 different countries. And we're situated in Braga in Portugal. At INL, at INL today, we have a lot of Indians. So the kind of understanding here in Braga is the Indian Nanotechnology Laboratory, that INL stands for, not International Intergovernmental Nanotechnology Laboratory. So it's a pleasure to be here together with you today. And of course, what we focus on at INL is a lot about different activities where nanotechnology is a key enabler. And one of them is, of course, in the health sector, and in particular with the sensors and different kind of possibilities to do detection. And in particular, we're focusing now about in the COVID time, because what we need is a detector that would allow people to have a normal life, go to work, go to airplanes, go to schools, go to theaters, go to concerts, etc. And the only way to do that, except vaccines, is to have something that can analyze very quickly that if you're transmissive or not. So it's not about detecting whether your symptoms is related to COVID or not. It's more to detect if you're transmissive or not, because you may be totally asymptomatic, you may not know, of course. So we're putting our efforts into how to detect the COVID particles. And we do that not from a biological point of view, but rather from a physical point of view. So we are building a system that will allow in a very short time to breathe into a tube, kind of, which is like an alcometer kind of thing, that will allow the possibility to know if you're a super spreader, if you're a spreader, or if you're not a spreader at all. And this is something that you could do for a cost that we estimate about €5 per test, which you can have in your home. You can have it in airports, you can have it in schools, you can have it in concert halls, restaurants, wherever. And this is one way, I think, that will make the society to go back to normal. And it's not only about the COVID, it's also about under pandemics with different kind of particles, let's call it like that, with different kind of functionalities. And the reason why this works is that the COVID particles, they're very uniform in size. So we can just detect the physical presence of them. Then if we detect them, we can do the biological test in order to understand, was it really COVID or not? But in the first instance, it's about the importance to select the people that may be super spreaders so they don't interfere with other people. And I think this is the way forward. And we're happy to do partnerships with every one of you. There are a few similar approaches, but no one is really doing the same thing that we are doing, targeting about a €5 kind of cost per test. So we are happy to work with anyone. We have a booth now in this conference, so it will be manned the total day today. So everyone welcome to go there, visit us, and have a discussion with us how we can work together. And we are particularly intrigued to even further explore our activities with India. So we have a couple of MOUs with a couple of institutions in India, but we're happy to do much more work with India. So with these words, I wish you a very much good conference today and a good workshop and good discussions. Thank you very much. And back to you, Paolo.
And also a round of applause for the work that INL. It's an incredible institution that is created by two governments of Portugal and Spain. And pretty much as in 500 years ago, Portugal and Spain initiated a new era in the world. I believe that INL can be the forefront of a new era. And we will so proud to have this partnership now, and to research and development global partnership, and definitely for the next year in the presidency and the European Union, India as a priority. There's a lot of potential that can happen. Thank you so much, Professor Lars Montelius, and thank you so much, Professor Dr. Ruivu, for your participation. You are now relieved from the session for your busy duties, because the war is there out there. You have to win this virus. Thank you so much. And now we'll proceed with the remaining of the session and the work on. Thank you so much.